was called by the nursing superintendent for a feedback on poor performance spent the remaining time of the shift blame her supervisor and colleagues. The mental mechanism used by her is: a nurse who was called by the nursing superintendent for a feedback on poor performance spent the remaining time of the shift blaming her supervisor and colleagues. The mental mechanism used by her is: option A, projection; option B, reaction formation; option C, rationalization; option D, compensation. The answer is option A, projection. Projection: blame for own difficulties upon others, or one's own unacceptable feeling and thoughts are expressed or they are due to others. Example is: a surgeon who did mistake in surgery may insist that it happened because of theatre nurse and technician did their task badly. Next option is the reaction formation. Reaction formation is the defense mechanism. The unacceptable real feelings are repressed and acceptable opposite feelings are expressed. Reaction formation is the defense mechanism. The unacceptable real feelings are repressed and acceptable opposite feelings are expressed. Example is: student who actually disliked her teacher hid her feeling by being always nice to her. Rationalism simply means the excuses. It is a defense mechanism in which individual justifies his failures and socially unacceptable feelings and behaviors by formulate logical reasons, the socially approved reasons. Or other definition is: rationalism is the attempting to justify one's behavior by presenting reasons that sound logical. Attempting to justify one's behavior by presenting reasons that sound logical. The example is: a girl fails to get admission for the nursing course may point out a number of difficulties of nursing profession. The next option is compensation. Compensation is a defense mechanism in which the anxiety relieved by an individual make up for a personal weakness. Other definition is: overachieve one area to compensate another. The compensation is overachieve in one area to compensate another. The example is: a student who fails in his studies may compensate by becoming the college champion in athletics. A student who fails in his studies may compensate by becoming the college champion in athletics. Which one of the following drug is a mood stabilizer? Option A, Librium; option B, lithium carbonate; option C, thirunal; option D, haloperidol. Correct answer is option B, lithium carbonate. Lithium carbonate is a mood stabilizer used to treat mood disorders. Option A, Librium. Librium is an anti-anxiety agent. Option C, thofranil. Thofranil is a tricyclic antidepressant to treat depression, also used to treat neurosis or bedwetting in children. Also used to treat neurosis or bedwetting in children. Haloperidol, the antipsychotic drug, used to treat mood disorders such as schizophrenia, schizoaffective disorders. The physician has prescribed 20 milliequivalent of potassium or KCl to a client. The available KCl is 10 milliequivalent per 5 ml. The nurse will administer. The physician has prescribed 20 milliequivalent of KCl to a client. The available KCl is 10 milliequivalent per 5 ml. The nurse will administer. Option A 5 ml, option B 7.5 ml, option C 10 ml, option D 10.5 ml. Our formula for dose calculation is desired amount divided by half available. Into quantity. So desired amount is 20. Half available is 10. The quantity is 5. So answer is 10 ml. The correct answer is option C 10 ml. Which one of the following is the drug of choice in ventricular arrhythmias? Which one of the following is the drug of choice in ventricular arrhythmias? Option A, Interval. Option B, digoxin. Option C, sorbitrate. Option D, lidocaine. The correct answer is option D, lidocaine. Lidocaine is the antiarrhythmic agent. Lidocaine used in ventricular arrhythmias. Option A, Interval. Interval is the trade name of propranolol. Propranolol is a beta blocker. Beta, it is used to treat high blood pressure. It is used as antiarrhythmic and anti-migraine agent. Option B is digoxin. Digoxin is a cardiac glycoside used to treat heart failure, atrial fibrillation and ventricular fibrillation. Option C is sorbitrate. Sorbitrate is an anti-angiogenic drug. Cyanotic spell is a feature of option A, TOF, option B, VSD, option C, PDA, option D, ASD. The correct answer is option A, TOF. The TOF or tetrahydrofolate, PDA, ASD are discussed in the Sreechitra previous question and discussion part 1. The link is given in the I button and in description box. So please watch that video. Next question is, an infant experiencing hypercyanotic spell is placed in. Option A, high fabulous position. Option B, knee chest position. Option C, prone position. Option D, supine position. The correct answer is option B, knee chest position. The cyanotic spell are paroxysmal hypoxic events in a child due to decreased pulmonary blood flow and right to left shunting. Cyanotic spell are seen in tetralogy of Fallot. When a hemophilic carrier female marries a normal male, the chance of their daughter becoming a carrier is option A 100%, option B 75%, option C 50%, option D 25%. The correct answer is option C 50%. Next question is, a nurse observed oblique spots on oral examination of a child with fever. This is indicative of a nurse observed oblique spot on oral examination of a child with fever. This is indicative of option A measles, option B diphtheria, option C dengue fever, option D whooping cough. The correct answer is option A measles. The oblique spots can be seen in measles. Next question is, census is taken once in every option A 5 years, option B 10 years, option C 15 years, option D 20 years. The correct answer is option B 10 years. Census is taken once in every 10 years. Next, the nurse is teaching a client about iron-rich food to be consumed to correct anemia. Which one of the following vitamins has to be supplemented to increase iron absorption? Option A vitamin C, option B vitamin D, option C vitamin B6, option D folic acid. The correct answer is option A vitamin C. Next question, in which one of the following leadership styles the leader values the individual characteristics and abilities of each subordinate? In which one of the following leadership styles the leader values the individual characteristics and abilities of each subordinate? Option A autocratic, option B democratic, option C laissez-faire, option D bureaucratic. The correct answer is option B democratic. Democratic is a type of leadership where decision making is shared with members. The option A autocratic, the manager make all the decision. Option C laissez-faire. The laissez-faire is a type of leadership. The leader lack direct supervision of employees and fail to take regular feedback to those under his supervision. Option D is bureaucratic. In bureaucratic leadership is a rule-based leadership style. It is mainly seen in the military section and government institutions. Next question, which one of the following is known as the pacemaker of the heart? Option A SA node, option B AV node, option C bundle of his, option D Purkinje fibers. The correct answer is option A SA node. SA node is the pacemaker of the heart. Next question, the left atrium and lateral and posterior surfaces of left ventricle is supplied by the left atrium and lateral and posterior surfaces of the left ventricle is supplied by the Options are option A, left anterior descending coronary artery, option B, left coronary artery, option C, right coronary artery, option D, the circumflex artery. The correct answer is option D, circumflex artery. The coronary artery is divided into right coronary artery and left coronary artery. The left coronary artery divided into left anterior descending coronary artery and circumflex artery. The right coronary artery supplies blood to the right atrium and right ventricle, the inferior portion of the left ventricle, the posterior septal wall, the synovial and ventricular atrioventricular node. The left coronary artery divided into left anterior descending coronary artery and circumflex artery. The left anterior descending coronary artery supplies blood to the anterior wall of the left ventricle, the anterior ventricular septum and apex of the left ventricle. The circumflex artery supplies blood to the left atrium and lateral and posterior surface of the left ventricle. Which one of the following is a potassium sparing diuretics? Option A, spironolactone, option B, mannitol, option C, furosemide, option D, chlorothiazide. The correct answer is option A, spironolactone. Spironolactone is a potassium sparing diuretics. Example of potassium sparing diuretics are spironolactone and amiloride. Potassium sparing diuretics acts on distal tubule to promote sodium and water excretion and potassium retention. Potassium sparing diuretics act on distal tubule to promote sodium and water excretion and retention of potassium. It is used for treat edema, heart failure, ascites resulting from cirrhosis, nephrotic syndrome and diuretic induced hypokalemia. Option B, mannitol. Mannitol is a osmotic diuretic. Example of osmotic diuretic are mannitol, isosorbate and glycerin. It is used to prevent renal failure and decrease intracranial pressure. Next option is furosemide. Furosemide is a examples of loop diuretics are furosemide and toracemide. Loop diuretic inhibit sodium and chloride reabsorption from the loop of Henle and distal tubule. Loop diuretic inhibit sodium and chloride reabsorption from the loop of Henle and distal tubule. Loop diuretics is used for treat hypertension, pulmonary edema associated with heart failure, hypercalcemia and renal disease. Next option is chlorothiazide. Chlorothiazide is a thiazide diuretic. Thiazide diuretics increase sodium and water excretion by inhibiting sodium reabsorption in the distal tubule of the kidney. Thiazide diuretics is used for hypertension and peripheral edema. Thiazide diuretics is contraindicated patient with renal failure. Example of thiazide diuretics are chlorothiazide, benzthiazide and polythiazide. Next question, tab digoxin is withheld if pulse rate less than. Tab digoxin is withheld if the pulse rate is less than. Option A 40 beats per minute, option B 50 beats per minute, option C 60 beats per minute, option D 70 beats per minute. The correct answer is option C, 60 beats per minute. The tab-digoxin is withheld if pulse rate less than 60 beats per minute in adult and 70 beats per minute in child. Tab-digoxin is withheld if the pulse rate is less than 60 beats per minute in adult and 70 beats per minute in child.